Recording in progress.
I'm going to wait just a minute before calling the meeting to order. We're waiting for a couple members to come in. I see Bridget. Yep. Bridget, I see you on the screen. I'd wait a month on that thing for CJ ATI. I think I've got more work to do, just so you know.
No problem, Rich. Thank you.
Okay. I'd like to call to order the meeting of the Public Safety Committee for Tuesday, May 23rd, 2023. And welcome to everybody. I see we have a full house on screen. And first order of business is public comment. Do we have anybody who wishes to address the committee?
We do. We have Zach Wynn.
All right, I'd invite you up.
Good afternoon. My name is Zach Wynn. I live here in the city. I would like to inquire about the fate of the gun-involved violence elimination grant funding totaling $380,000 that was offered by the New York Department of Criminal Justice Services to Tompkins County and the city of Ithaca. The city of Ithaca has had decided to not participate, blaming a lack of staffing in order to implement the program. I understand that tomorrow, the 24th, is the deadline for submitting a workable plan. I'm also curious if the sheriff, DA, and probation were able to manage a workaround to the city failing to participate, essentially is my question. I would also like to know about the reported spike in burglaries. Department of Emergency Response received 172 reports of crime compared to March. That's a 32% increase. It wasn't just crime in general. I'm curious if county law enforcement has an explanation for this spike and a plan to counter it. And is there any reason to believe that this trend will not continue? I yield the remainder of my time. Thank you.
Thank you. Is there anybody else who wishes to address the committee? Anybody online? Seeing none. And given the question was posed, Sheriff, do we have any news on the, or Matt, on the GIVE grant?
Yeah, Rich, I planned on updating you during my section, but I'd be happy to do it now if you like.
Yeah, why don't we do it now?
Okay, sure. Yeah, we've been plugging away at the application. Like Mr. Wynn said, the deadline for the final application was technically tomorrow, although they gave us an extension until Friday. I've been working with Dan and Matt both on responding to questions they had in response to our initial application. That's going well. I still have a couple more sections I have to update. I met with Acting Chief Ted Schwartz today, which was the second time I've met with him in the last week. Very positive meeting. We are continuing to manage the grant through the county at this point, developing a task force and coming up with a plan on how to best utilize the funds moving forward to lower violent crime in not just the city of Ithaca, but in Tompkins County as a whole. So we made very good progress, and I have no doubt we'll have the final application submitted this Friday, if not earlier, and we'll take it from there. As part of that, I also have Captain Bidwell from the Southern Tier Crime Analysis Center coming to the Sheriff's Office next Wednesday. They do a lot of crime mapping and data gathering related to violent crime. I just recently signed an MOU with him which was part of this grant application. And hopefully they're going to get on board to help us out as well. So a lot of good things happening. I'm excited about it. And I thank Dan and Matt for both them helping with this application, which has been quite tedious. So we're just about there.
All right, well, thank you for that. Sorry to put you on the spot there, but that was a great report. Dan or Matt, did you have anything you wanted to add? Okay. Matt?
Only to give credit to Derek for really bringing us over the finish line. I think we're pretty close to the finish line, so we should all be grateful to Derek for picking up the ball, and to both Derek and Dan for making this happen.
Okay. Well, yes, thank you. All right. Any other public comment? Seeing none, I'll keep moving. Any changes to the agenda? We will be having a report on EMS service as part of Department of Emergency Response, but that will be under Michael's general report. We have minutes from April 20th, 2023. Could I get a motion on the minutes? Veronica moves and seconds. Any questions or comments on the minutes? Are we ready to vote? All in favor? All right, that's unanimous. We're up to Chair's report. And there were a couple things I wanted to just touch on briefly. One of our priorities for 2023 that we stated was trying to do something to better track overdoses in the community. And we've talked about how difficult this really is because of the nature of overdoses. But I didn't want it to sit on the sidelines. I talked to the CJC to see if they had a role to play there. They didn't really think they should be involved, but the health department is working on this. They have one of the health fellows is actually trying to work on a protocol to do this. And just to maybe take a minute for conversation on it, my sense is that this is something that you're never going to do perfectly and perfectly accurately. What you can do is get a general sense and determine trends as a result. And I was looking at the different information sources we could rely upon or call upon in the county, and they're really pretty broad. I mean, there's certainly the ambulance services and the 911 center calls, the police agencies, the district attorney, but also OAR, URO, REACH, STAP, and then just reports from the public if we went about advertising it in the right way. I think we'd have to be very clear about this information would not be used for purposes of prosecution, but for really trying to determine the nature of the issue in our community. I'd love to get comment from other committee members if you guys have thoughts. But I hope to have this in more detail from the health department with a more formal proposal soon. Ann.
Yeah, I know we've talked about overdoses in the community before, and tracking I really think is something that would be really beneficial as best we can. I know some people might overdose and it doesn't involve any agency, and we have private ambulance services, we have small municipal ambulance services, we have the hospital, like you said, REACH, and so all kinds of, and soon to be open the immediate care through Cayuga Health downtown. So I think there's so many different agencies, but I think it is worth tracking, like you said, and then what information we do have, and then we can see trends, and then respond to that, figure out how to respond to that, or be proactive, of course, but at least to have that data.
Yeah. Well, I'm still cognizant of the woman who came in whose son overdosed and died, and we really said then that we do want to do something, and this would be something substantive. So hopefully
one more question.
Yeah.
Is this something? Well, I guess you don't know, but is this possible? Like depending on how we figure out how to do that we could possibly use some of the monies, the opioid settlement monies?
I would think so. You know, I don't want to step on anybody's toes who has great plans for that money, but I don't know that this would cost a lot of money. There would be some coordination that maybe we could apply a small amount to, but I think this is pretty inexpensive, but that's a good idea.
Like a dashboard or
Yes.
that everybody can feed right into or something?
Yeah. Yeah. Did you have something, Mike?
No, I mean, I was just thinking of two things. I mean, I think it would be great because it would be nice to know actually who's overdosing too. I mean, it's not just how many, it's a matter of what segment of society. I think we always assume it's a certain set, and this may prove out not to be that. And I think sometimes when we challenge things like that, you find out something different. I will say I took training on one of the AEDs, and Narcan training was part of that, and much simpler than I had. Even that was much simpler than I thought. Like, if you have a Narcan on you and you give it to somebody, even if they weren't overdosing, you can't harm them. Like, I didn't know that. So I learned a lot from that training. So just something interesting.
Yeah.
Something so simple that's out there for that. So.
Yeah. I agree with you that we're not nearly as smart as we need to be on this subject. We just don't know what we need to know. So anyway, more to come there. And I hope to bring that to the committee perhaps later in the summer. Hopefully we'll have something from the health department with more substance to it, but I want to make sure we move there. Another item that I'd like to have a report on perhaps this summer, because it would be about the year anniversary, is the 988 number, and seeing how that is working for mental health services, and see if there's been more calls as a result, and the nature of the calls, and hopefully we can get a report from that direction. And then finally, I wanted to just talk briefly. The jail working group has continued to meet. We are going to meet at the beginning of June. We've invited judges to come in and speak with us, among other interested parties. And so that should be some interesting comment, hopefully helpful to what we're doing, but we still seem to be on track to get our report out back to the legislature after our July meeting. So that's all underway. And that's Chair's report. Anybody have any questions for me? Or okay. County Administration. Lisa Holmes, you're with us. Welcome.
Yes. Thank you, Rich. Just a couple of updates on my end. One, I wanted to update the committee on the transport of asylum seekers from New York City to upstate counties and news on that front. We continue to receive briefings from the governor's office and NYSAC on this issue, but there's been no substantive change in our status since the last time I updated legislators on this issue. As of last week, New York State had embedded staff in New York City's operations with the goal of maximizing state and federal resources to help, including the use of state and federal facilities to temporarily shelter asylum seekers. They are looking to try to keep individuals as close to New York City as possible. But at the same time, the state staff is actively investigating the use of SUNY campuses throughout the state. And we hear from the governor that there will be plans for better coordination and communication going forward. But as of yet, there have been no plans communicated to us here in Tompkins County on this. In the meantime, we have been speaking with several of our departments that would be involved, and as well as our community partners, and we'll just be continuing to brief all of our partners that we've engaged so far to keep them up to speed. We'll be briefing folks tomorrow morning on the situation as it unfolds. So happy to take questions on that.
I have a question. Has there been any discussion with TC3 about trying to enroll them as students in the fall?
Not about enrollment.
Using the dorm,
About
perhaps.
using the dorms, yes, but not about enrollment.
This seems like a situation where being proactive of not just housing people, but trying to figure out where they could be useful and productive in the community. You know, we're holding jobs fairs because we can't seem to get people to work. I was curious if New York State was doing anything about the 90-day requirement, I think there is, before somebody can work. Is that being addressed?
It's a 180-day requirement, and it's a,
I cut it in half.
yeah,
6 months.
and it will take action by Congress to do that. So what the governor has said is that she has been in close communication with the federal government to try to change that. But what I'm also hearing from other counties is that that 180-day is a minimum that often do, so that it's a statutory delay, but then there are also administrative delays that are over and above the 180 days that make it closer to a year and a half, 2 years.
When does the 180 days start? Is it when they enter the country?
I believe so. So, yeah, so it's indicative of issues on the federal level and also the state level, you know, just in terms of immigration in this country, but it boils down to a local issue.
I guess we're going a little far afield from public safety, but there are public safety aspects to this if it's not managed appropriately. And certainly my view is that we will get people here, and we need to be prepared. And we need to do it, I believe, in an active, compassionate way, that it's not just a state of emergency to try to keep them out. Ann, and then Mike.
I won't go on too long because we could go down a rabbit hole about this, but I like, you know, the idea about offering, you know, some optional training or certifications or something, you know, whether it's driving, you know, driving skills, you know, English as a second language for those that need it, any other training for specific jobs, you know, for that we need people in. You know, if we had some optional training, and it'd have to be provided free while we're still taking care of those folks, but I don't know if other folks are doing that around the country. That'd be interesting to find out if there's already some programs or something set up where we could possibly get reimbursed even, but, you know, to just really be ready and really have a vibrant program for people to help them.
Mike.
I was just wondering, I mean, I know we've been talking about the TC3 dorms, but, I mean, I know they were empty for a while, but I thought we had not solved that problem, but I thought that problem had gotten much better, and that we have students in them now. It's kind of like they're talking about the SUNY schools, and I'm like, yeah, but aren't there students in those?
Some are.
There are.
I mean, this is not.
Yes. That's why we were pointing the state toward the state's already owned facility.
Right.
Probably a longer-term option.
I'm not incorrect about TC3, right? I mean, I was hoping they weren't sitting empty because they built them.
I thought one had been mothballed.
They do have space. They do have space in one dorm, is my understanding. And, you know, we've been in touch preliminarily on that. And, yeah, so they do have space in one dorm. Mm-hmm.
You had another item.
I did. And Mona is here from the Community Justice Center with a brief update on the CJC Advisory Committee.
Hi, thanks, Lisa. Good afternoon, everyone. I'm just going to give you a really short update on the CJC. The advisory board has begun. As a reminder, you know, what our purpose is for having the board, and that is just to oversee and advise the legislature, common council, and the CJC project director so we can improve public transparency and accountability. The composition of the board was created. It was a pretty good first meeting, to be honest. I think everyone that was there was happy to be there, especially the community members. I do have a list of representation for the advisory board. So for the impacted stakeholders, we have Sheriff Osborne, District Attorney Van Houten, assigned counsel with Lance Salisbury with us. Travis is the representative for LEAD. Frank for mental health, and then for REACH, which was our substance prevention program, we picked Samantha Stevenson as one of us. We have 3 impacted community members right now that are active. We are still accepting applications for more, so if you guys know anyone that's out there that might fit the role or the vision we have for the impacted community members, please have them apply. We have 7 available slots, and we only filled 3 of them at this time. And then we have non-voting members. We have someone from the mental health clinic here is Marie Boyer, and she works does a lot of work with some of the gentlemen and women that have been incarcerated up in the jail. Representing youth services of Tompkins County as a whole, not necessarily county youth services, is Siobhan Brunch, who's the executive director at Southside. From the legal field, we have Honorable Rick Wallace, who joined us. Common Counsel is Phoebe Brown is a representative, and then for County Legislature, we don't have anyone with us yet. I am working with Lee Shurtleff on getting him on board. So that's where we're at. We had our first meeting. We are talking about meeting cadence and things of that sort. At our next meeting, we'll elect the chair, and we'll go from there. So it was a really nice first meeting.
Thank you, Mona.
Uh-huh.
Questions? Mike?
Who are the 3 impacted community members that are on the board?
We have Dr. Susan Eschbach. She used to be the principal at Beverly J. Martin. She has 2 children that are minoritized population that have had really, really good involvement with law enforcement, some not so good involvement with law enforcement. We have a gentleman by the name of Keegan Young, who has the lived experience with law enforcement. He did quite a few years in a state prison and is now working for URO. And then we have a young lady named Danelia Rinnehover, who has been in Ithaca for, I think, the last 5 years. She is from the minoritized population, and she was doing some work over at GIAC at one point, just like volunteer work. So those are the 3 that we have at this point.
Thank you.
Hey. Ann, did you have a question?
Yeah, so glad to hear that's your group is, or the board is getting populated. Can you send us an email with the information, and we could try and, reach out to our contacts in the community and our municipalities of, what kind of requirements or what you're looking for in those folks?
Absolutely. Dominic put up together a really nice press release for it, so I'll just forward that to you.
Okay, and you said that the board is part of the mission of the board is to be transparent and accountable to the community?
Yeah.
Okay, great. Thank you.
You're welcome.
Okay. Anything further, Lisa?
That's it for me. Thank you, Rich.
Great. Any questions or comments for Lisa? Okay, let's keep going. Sheriff's Office, welcome.
Thanks, Rich. I just wanted to reiterate, I know I mentioned it in our opening comments that I had a meeting with, or 2 meetings now with Ted Schwartz, the acting chief from IPD. I just wanted to express my pleasure in interacting with him. I haven't had a lot of experience with him over the years. Our careers haven't really crossed paths, but I really see a benefit of the city putting somebody in charge, and I think he's going to be a positive influence on the police department. And thus far, I found him very easy to work with, and I hope that continues, and because I think that benefits law enforcement in the county as well when we have IPD going in a positive direction. I still think they're going to have a lot of work to do with their recruitment and retention, but I think at least having somebody in that leadership role will hopefully make a big difference moving forward. In addition to the task force we're trying to put together for the GIVE grant in addressing violent crime, specifically in the city, but also in the county as well. A lot of people in the county, including Dominic, DA, Mike Steitley, Harmony from the health department, Dominic, As you know, we put together a domestic terrorism plan in response to Executive Order 18. We're going to have our first meeting on June 28th at Dewar with our task force members to get the ball rolling on that. So I'm excited about that. And I could really see the two task force groups probably gathering a lot of the same information. So I think it's going to lead to a positive direction for hopefully preventing violent crime in our community. You have my written report. You can certainly ask me any questions on that. The only other thing I have is some staffing updates. As you all know, we did implement sign-on bonuses for our corrections division and also bumped up the starting rate in response to not being able to settle the contract right away. That is continuing, and I believe we have another mediation session in June. But we've got our staffing levels up to the point where we were able to fill a sergeant position in the jail. We made that promotion today. That'll take effect in 3 weeks, I believe. Conducted a couple other CO interviews today. I plan to offer them positions hopefully tomorrow. And if they accept, that'll leave us with just 2 openings in the jail, which is a huge step in the right direction. So everything's working as it should, and I think we're getting there. Similarly, on the road, as far as deputies go, I offered a young man a deputy position last week. He accepted. He'll be going to the academy, I believe, in June, and that'll leave just 2 openings on our road patrol. So I think we've made a lot of good progress. I'm happy with that, and that's all I have at this point.
Okay. Well, that's very good news on the staffing. Yes. Questions, comments from the sheriff? Again, thank you for all the work on the GIVE grant. I know that has been a sort of odd process, that it's not, typically you get a grant application, you fill it out and submit it, but this seems to be a lot of back and forth, but going in the right direction. So, yeah. Yeah, Mike.
I just wanted, the burglary thing that was brought up earlier, is that a city issue?
I'm not sure what that is, Mike. I haven't seen a big influx of burglaries impacting the sheriff's office. I can say typically in springtime, they do kind of ramp up a little bit just with the weather. While county administration was speaking, I did quickly check in with one of our investigators, and he relayed the same thing. He wasn't familiar with a big spike that we've seen through the sheriff's office. So I'm not sure exactly what that is. I know those stats cover a multitude of agencies in the county, but we're not seeing it in the sheriff's office, anything beyond what's normal for springtime.
I got you. No, it was on WHCU this morning. That's why when he said it, I was like, oh no, I just heard that actually.
Certainly the Tomstat report doesn't seem to show a bump there, right? The 911 calls aren't. So yeah, I was curious about that as well. Yeah. Okay, you have a resolution, and why don't we take care of that? Authorization to accept New York State Canal Corporation Marine Patrol Grant, ID 11669. Could I get a Lee moves and seconds? Do you want to speak to that, Sheriff?
Just simply to say that's money the state offered to us. We don't typically receive that. $20,000 for our Marine Patrol is quite a bit of money, and that will go a significant way towards getting patrols out there on our boat this summer. So I think it's a good thing, and we'll happily accept the money and use it accordingly.
Okay. Any questions, comments? We're ready to vote. All those in favor? That's unanimous. Great. Anything further for the sheriff? Because we have a lot of people waiting for the report from emergency response, Matt, is it okay if we put emergency response now and pick you up in a minute or a few minutes? Okay. Michael, welcome.
Welcome. Thank you. Appreciate it. Before we get started, I just want to acknowledge a few people that are on the call and in the room. Mark Whitmer from the TCOG EMS subcommittee on the call with us. Mayor Hart was going to join us, but he was not able to at the last minute. But Dan Lamb, Assistant Town Supervisor from Dryden, Ellen Woods will be here shortly from the Enfield Fire Department EMS Department. Calvin Carr, the County Fire Chiefs Association President, Brad George, the Chief of the Lansing Fire Department, and Josh Nally, who's Assistant Chief in Lansing, but also, as you know, the Chief of the Airport Fire Rescue. This really just makes up a very small group of people that have been part of our steering committee that brought us here today. For those that don't know, the work that we're going to be addressing today really began in 2016. When an EMS study was done, actually when Lee was still the director at the Department of Emergency Response, and then a second study was done in 2021 through the EMS subcommittee of TCOG, and that's about the time that I joined that committee. And then last fall, we met with the Public Safety Committee, and we talked about a vision of what we could do to help augment the community-based EMS services that are struggling with response times in their community. So I just, I've said this before, I feel that, really, I'm a steward, and I feel that, some of what we're able to maybe bring to your attention today or even to fruition has really started through the vision of others, long before me. So at any point in time during the presentation, I invite those that I've named to, feel free to add any comments, and I just appreciate them making time today. And I also provided a letter to you today, Rich, that I was given just this afternoon by the Tompkins County Fire Chiefs Association in support of the Department of Emergency Response.
I'm trying to remember, did that go to all the committee members?
It didn't, because I only said I wasn't sure of the etiquette on that, so I said, okay.
Please share it with everybody else.
Okay, I will do that immediately after. And again, I just got that today, so.
And just to, not spoiler alert, but the letter was in support.
Yes. So thank you. So Joe Milliman, our new EMS program manager, will be taking the helm at this point to go over the EMS, what we originally called the Fly Car program, we're now referring to it as Rapid Medical Response, and he'll touch on that as to why we've decided to change the name. And at the end, you'll see all the community members that helped bring this vision to you today. Joe?
Thanks, Mike. So the presentation is going to kind of start off. I know that this committee was pretty monumental in developing my position, so we're going to start by just kind of going over some of the work that I've been doing over the past few months, and then we'll kind of slide into what hopefully our vision for the future is. So I can move that right out of the way. All right, so the first big thing that we've implemented is we've returned to holding EMS leadership meetings. And for the sake of this presentation, the term EMS includes both transport and non-transport EMS agencies, so fire rescues as well as ambulances. These meetings are monumental in bringing leaders of Tompkins County together. In these meetings, we discuss both changes to county, region, and state protocols, policies, and procedures, but it also allows EMS leaders throughout the county to come together and discuss changes that are going on in their organization or their towns. We've partnered with CMC and SUNY Upstate to create a satellite paramedic class here in Tompkins County. We're hoping for a go-live date of this fall or early next spring. Currently, the closest paramedic program is in Elmira, so anybody who wants to further their EMS education, become a paramedic, has to do quite a bit of traveling just to attend class, and that's obviously a very big time commitment to begin with. We're currently working with TST BOCES to introduce basic EMT classes to the county for high school students. We're going to continue to work with TLC EMS out of Cortland to continue their involvement with teaching the basic class and a EMT class to both students and adults alike. And we've implemented a Google Calendar that any agency can post a training opportunity that is available to all EMS providers in Tompkins County. One of the big factors that people bring up a lot is that there's not a lot of EMS training in this county. So by getting the word out there that these classes are available, people are able to attend those and get their CME hours in.
Can I interrupt for a second?
Absolutely.
Where are those classes going to be held?
Which ones?
Well,
all of them?
Well,
so
the BOCES ones, I assume, are at BOCES classrooms?
Yeah, so the satellite paramedic program will be held at CMC. They have some classroom space to be utilized. BOCES will be held right at BOCES for the students. TLC teaches throughout the county. They're generally at local fire departments that have some space, classroom space available. So that's going to change for each class depending on where the need in the county is. And then the training calendar is at whatever agency is hosting their class.
Okay. And I have a second question.
Mm-hmm.
Do we know how many EMTs are in the county?
I do not have an exact number, no. I can work on getting a number. There's going to be, I guess, two different numbers. There's going to be the number of certified EMTs and the number that are actually active and practicing as an EMT.
Okay. I would, not to put you to unnecessary work, but I would love for us to have that information so we could set a baseline and perhaps challenge ourselves that 6 months from now we say how many EMTs do we have, and a year from now, and see how effective we are at pushing this. So, but sorry to interrupt.
No. The American Safety and Health Institute is an organization of health educators. We teach classes such as CPR, first aid, bloodborne pathogens, epinephrine, Narcan, babysitting safety courses, the list goes on. As of the beginning of this month, Tompkins County Department of Emergency Response is an ASHE training center, so we now have the ability to host all those classes, and they'll be available to both EMS personnel, healthcare providers, and just the layperson that wants to take some of these classes. Central New York EMS, which is the regional governing body of EMS for Tompkins County, along with 4 other local counties, currently distributes Narcan free of charge to non-billing EMS agencies. One of the complaints that a lot of agencies that utilize this program in this county have is Central New York EMS is located in Syracuse. So getting to Syracuse to get the supplies for the Narcan program is very limited for them. So we've established a plan where we're able to get up to Syracuse to get that Narcan and the supplies for those agencies, bring it back to Tompkins County and distribute it for them to use. We also have partnered with the New York State Office of Addiction Services and Supports. We're hosting free opioid overdose and Narcan training to the general public throughout the county. We just had a class last night in Groton with participation with the Groton Fire Department and the Groton Central Schools. I know Enfield Fire Department has also paired up and hosted this class, and we're excited to continue to work with them and hopefully get more classes out to the general public. Rapid sequence intubation, or commonly known as RSI, is a protocol for patients that need immediate airway treatment. We give 1 sedative and 1 paralytic. It sedates and paralyzes the patient, and the providers that are doing this skill have to be certified on top of their paramedic certification. They'll intubate the patient, put a breathing tube in, and secure their airway. Currently, there is only 1 agency in Tompkins County, and that is Trumansburg EMS, that is currently RSI certified. They just received that certification with a handful of their providers. T-Burg has spearheaded what we call Signal 41. It's a county-wide initiative for the use of the RSI program. So if you are a non-RSI agency, you can activate what we call Signal 41. You will get a team of RSI certified paramedics that will show up and help you maintain the patient's airway. Eventually, we're looking to move this into more Tompkins County agencies, and hopefully someday maybe all Tompkins County EMS agencies will be RSI certified, which will help improve patient care.
Yeah, sorry to interrupt again. Is this a new initiative? Is this a new medical treatment?
It's not a new treatment. RSI has been around for a number of years, but the requirements to become certified as RSI are pretty stringent. So it's a pretty big deal when an agency becomes certified as well as their providers. So we definitely, our hats are off to Trumansburg for implementing this.
Yeah, just to add to that, in the rural community, it's imperative to have agencies that can perform this skill because we often need helicopters to move our trauma patients to either upstate or Robert Packer. And one of the reasons that we need a helicopter is because we need to be able to do advanced airway treatment, and that's what you get with RSI. So by having EMS crews that are capable of doing it and beginning that technique early on, if they have to go by ground and they're not able to go by helicopter, that will help those patients long term. So hats off to Trumansburg.
Ann?
Real quick, I know, I see Mark over there struggling to hear. Do you want to ask him to come to the table? He's having
Yeah.
trouble hearing these.
Would you like to come up to the table? Yeah, please.
We have speakers right up at the table, so it's easier to hear. Yep.
And Rich, just to kind of touch a little bit on RSI, I know the slide is kind of vague, but the reason why RSI is so difficult to obtain and maintain your certification is once we administer that paralytic, the patient can no longer breathe. So you get one shot.
You got to do it right.
It's a pretty big deal, and it's I'm very proud of Trumansburg for getting as many of their providers certified as they did. That's a really, really big thing that they did. So.
Okay.
For those that don't know what CISM is, it's Critical Incident Stress Management Team. It's a team of individuals that help first responders debrief and cope during extremely stressful incidences. Really, it's there to help lower burnout rate, increase mental health awareness, and just get them the help that they need. I think most first responders would agree that we tend not to talk about things that are bothering us, and we bottle them up, and that's what causes our burnout. So we have identified a group of leaders that are going to be our county CISM leaders, and we are currently working on planning to implement a CISM team. This, again, will be a team of people that will be activated during mass casualty incidences, any kind of a call that involves a fatal, or just any incident that somebody finds stressful. They can activate this team. We can debrief, we can talk about it, and we could also point them in the direction to get further help if they need it. Currently in New York State, all agencies are required to have some sort of quality assurance. In Central New York, it either has to be at the county level or the individual agency level. Many of our smaller agencies are struggling to find the data that they need, the personnel that they need, and meet the requirements that they need in order to hold a continuous quality improvement committee or CQI committee. So I kind of put some feelers out there, and we had a lot of interest expressed from some of our smaller agencies to do this at the county level. So we actually have our first meeting the 1st of next month. We will meet with all the agencies that are interested. CMC has also volunteered to help us out as well. And we'll meet on a regular basis to discuss patient care, where we can make improvements, where county policies and procedures can or should change. And, I think when most people think of CQI and they think of reprimand, and that's not our goal. Our goal is to find areas where we can improve pre-hospital care. So for my position alone, I've started doing EMS and fire coordination with the assistance of Justin Van. And in my first 2 months, I've already responded to one MCI involving a school bus, a fatal house fire, a non-fatal house fire, and it was also utilized in planning for Cornell's Dead and Company concert. This year, we've decided that we wanted to really acknowledge those that work in our county in EMS and kind of really boost their morale and acknowledge all the hard work that they've done. So we held our first annual EMS Awards this week, which kicks off EMS Week, which runs to Saturday. This year, our awards included an ALS and BLS Provider of the Year. Emily Dove and Caleb Wood both went above and beyond their normal job description in order to provide amazing care to those in their communities. Crew of the Year was awarded to Caitlin Gorton and Andrew Chambers from Dryden Ambulance. They responded to a call that they really put forth some really good effort, and they ultimately saved a patient. Agency of the Year, we awarded to Trumansburg EMS. On top of their RSI spearheading their Signal 41, they've done a lot of patient-centered care to their area that we would like the rest of the county to kind of follow suit with. The Tim Bangs Lifetime Achievement Award was awarded to Brian Snyder of Trumansburg EMS. So this award was also acknowledged by Tim Bangs. It's for an individual who has dedicated their career, whether paid or volunteer, to EMS, and they've done an outstanding job at providing care to their community. So Brian Snyder, who has had his entire career in EMS and is looking to retire in the next year or so, we felt was a very fitting recipient. And the last award we awarded this year was the Excellence in EMS, and that went to the Tompkins County Sheriff's Department, the Tompkins County 911 Center, and Airport Fire Rescue for their actions in saving the life of a passenger at the airport last year. So I guess what we're really here to talk about is how is this county doing in EMS overall? This timeline kind of shows a really good background. I don't know if we can get that off of there, but really the changes in Tompkins County started in 1991 when Lansing Ambulance closed its doors. Shortly afterwards, Dryden Ambulance was formed, and Groton and Trumansburg both started paying their EMS personnel. Thank you. In 2016, we started what's called determinate dispatch, which we'll kind of go over what that really means here in a few minutes. Slaterville closed its doors shortly before the pandemic, and as of today, Speedsville has a rescue in their firehouse. However, they don't have any EMTs to operate that rescue. This is a list of all of our EMS agencies with the exception of Ithaca Fire and Airport Rescue because they're both paid rescue services. On the far left are all of our BLS or basic life support rescues. Speedsville is in orange because although they have a rescue, they don't have staff to operate that rescue. So they can respond for manpower once an ambulance is there, but they can't respond to initiate life-saving care. Cayuga Heights is our only ALS or advanced life support rescue at this point. And all of our transport agencies are on the right, and as you can see, Lansing and Slaterville in red because they both have closed their doors in recent years.
Would you just go one more time what a rescue unit is versus?
Sure. So a rescue agency is a non-transporting EMS vehicle. So in order to respond with a rescue, you have to have at least one EMT. They'll get to the scene generally before your transport agency. They'll start initiating life-saving care, stabilize the patient, so when the ambulance arrives, they can transport. Our rescues are based out of our fire departments. So the big ones like Brookendale, Danby, their transport agencies are going to be Bang's ambulance. So they're going to be a lot closer to the patient than Bang's ambulance will be. So that's where you really see a rescue utilized to its full potential.
So if Speedsville has no EMTs, they really don't have capability there, is that?
Correct. So they are still a certified rescue. They still have their certification, but they don't have the capability of responding as a rescue at this point.
Okay.
So this is a plot map of every EMS call for 2022, broken down by agency, transport agencies. So Trumansburg, Bangs, Groton, and Dryden. It really shows you just how widespread across our county our EMS calls really are, and they're not just focused in on one area of our county. So EMD codes are what we use to know the severity of the call when it's dispatched. So starting at the bottom, Omega is a non-medical call. It's a public assist. Nobody's hurt. They just need some sort of help, whether it's getting in and out of their house, into the car, that kind of thing. Going back up to the top is your Alpha, which is a non-emergency BLS call. It's minor injuries, bumps, bruises, scratches. Maybe they need a Band-Aid. They may or may not go to the hospital. Bravo is a little bit more serious. Good example of those are going to be somebody who has fallen, is bleeding, may have stricken their head. They're still minor injuries, not super life-threatening, but these patients are more likely to be transported to the hospital. Charlie, Delta, and Echoes are all considered advanced life support calls. They all have some sort of a life threat. So your Charlie calls are your chest pains, your shortness of breath, your strokes, but other than those complaints, everything is okay at this point. Delta, we generally see a little bit more with altered mental status, and echo calls are your ineffective or lack of breathing patients. So earlier we talked about determinate dispatching, and that's what this slide really shows. So all the blacked out boxes are the types of calls that those rescues do not respond to. And that's what determinate dispatching is. That is the agency has decided, so Brookendale has decided they do not want to be dispatched to Alpha, Bravo, Charlie, or Omega calls. They're only going to be dispatched to Delta and Echo. Unfortunately, when you look at the left, those are the numbers based on the number of calls that they are dispatched to. So of Delta and Echo calls, Brookendale has missed 44% of their calls. Danby has missed over a third of their Bravo, Charlie, Delta, and Echo calls, and Aetna has missed over 50%.
I'm sorry, when you're, that the percent unanswered are the calls that they say they will respond to, but they don't get to.
Correct.
So sorry.
Yeah, go ahead.
Yeah, because I'm just thinking. So they're like unavailable, so like at, when I've been up, to the emergency dispatch center, so it'll just show that they're unavailable, right? Is that?
So not necessarily. It could be it could be a peak time of day where they just don't have volunteers around because people are at work, so they don't have the crew to respond. It could be by choice that people are just busy and don't want to go. So those are the number of calls that they were dispatched to, that their pager went off. There was a need for help, and they were unable to get out the door for one reason or another.
Right, but if I could just add, so when we set up a response plan for a particular community, we base it on what they're willing to respond to. So in using Brookendale as an example, where they don't go on Alpha, Bravo, Charlie, or Omega calls, if we code it in that fashion in the 911 center, when we pull up the response plan for that particular call, it won't even tell us to dispatch them, so they won't get dispatched. In that case, would only go to the transport agency. Does that help?
Right, but so I think I understand that, but I'm just saying the ones that you tried to dispatch them to, 44%.
They did not
That's
make
correct,
it.
right.
And so then what happens operational-wise? Is that then you have a delay in then getting somebody there?
So that means that the first certified EMS provider to arrive on scene is going to be from Bangs, from their transport agency.
But is it a delay in trying to get somebody else there?
It's not a delay in trying to get somebody else there necessarily, because Bangs is going to be dispatched at the same time, but it's going to be a delay in that patient receiving care.
Because they're further away?
Correct.
Okay.
And
Thank you.
sometimes when a call is dispatched as a Bravo, for example, that's based on the information that the caller gives the 911 center. So sometimes when the first responder gets there, they might decide, well, it's actually a Delta or an Echo call.
Sure. Thank you.
Veronica, did you have something, or?
Annie asked most of it, but are there any situations in the plan where more than one rescue would be dispatched, presumably not simultaneously, but sequentially or something to the same call?
So sometimes, one of the dilemmas that we have found is that, some communities have very strong rescue programs and some don't. So we did make a recommendation to the Chiefs Association about having a mutual aid plan established so that if one rescue agency isn't able to go, that we then move on to the next one. But the problem that we ran into, and I can certainly sympathize with them, is what they don't want to do is be burned out. So if they're strong in their community and they can answer their calls, but their neighboring community has challenges, they don't want to have to then answer all their neighbors' calls because they don't have a rescue that can respond. So what they've asked us to do is to work with the transport agencies that are now responding, that have been dispatched simultaneously with the rescue units, if they still need the assistance of a rescue unit. And if they do, then we will then call a mutual aid. We just won't do it automatically.
Okay. Mike?
That's a great question.
So I'm still having a little trouble reading this. So if you're in Brookendale, the Bravo and the Charlies, you've got a problem then. If I'm reading this correctly, even though some of these other places have worse numbers when it comes to unanswered calls, the Brookendale ones, the Bravos and the Charlies those are serious. And did they just go unanswered?
From Brookendale Rescue, correct.
So those calls would only, in that instance, using that community, would only have a transport agency dispatched, and in that case it would be Bangs, because Bangs is who's providing their transport service if they're they're busy, and they typically are able to get there. But obviously we know where Brookendale is and the response time, so it could take 25 minutes to get into the southern end of the county for Bangs that might be coming out of the city or even out of the hospital. So those Alpha, Bravo, Charlies, and Omega calls would typically not get a first responder.
Now I see what you're saying.
Yeah, and this sort of lays the groundwork for the rapid response program, because that's what we're trying to help the communities really address is this issue.
This is great information to have. Thank you.
So from 2018 to 2022, we saw an increase of over 1,600 calls for EMS services in Tompkins County. And we also saw a significant increase in our response times. So the national average for EMS responses is roughly about 4 minutes. That's the benchmark that we try to beat. And if you look at the times from 2021, not a single rescue unit made that benchmark in 2021. So that's some pretty significant numbers when you're looking at 20 minutes, 23 minutes for your first EMS personnel to show up on the scene of an EMS call. So after we go through all that data, what does it really mean? It means that less of an EMS response is leading to longer wait times for help. If that goes uncorrected, that longer wait time is going to lead to decreased survival rates. And that's kind of blunt, but that's kind of what we're here to talk about, is just what it means to be waiting longer for an EMS person to show up. So that brings us to our rapid medical response. We're going to kind of talk about the idea of a pilot program that we'd like to pitch. First, we'd like to kind of go over what some of the other counties in New York State are doing. Chattagay County currently has 4 staffed ALS fly cars, 2 supervisor cars, and 1 BLS ambulance. Shenango County has 2 ALS fly cars and 2 BLS ambulances 12 hours a day during the week. Sigler County just recently started with 4 ALS ambulances that's currently being operated by the Cuga Health Systems. Essex County has ALS fly cars, and Wayne County has 24/7 ALS fly cars that they could also use to backfill any ambulances that might need the staffing. Niagara County and Steuben County are both in the process of developing their form of a response team. And just keep in mind that these are just some examples. I think at this point, the majority of counties within New York State have some sort of either plan in place or working on developing that plan. So what is rapid medical response? We've defined it as a strategically placed team of first responders to assist in timely response to medical emergencies. This allows for a fully trained EMS provider to respond to the scene, initiate life-saving care, give report to the incoming ambulance, or cancel the ambulance if they're not needed, and allow the ambulance to respond to other emergencies as they arise. This is an opportunity for shared services within the county, but it's important to note that it is not going to be a transport ambulance, and it's not here to replace community-based rescues. Ultimately, it's here to supplement and enhance our current EMS system.
Monica?
Can I ask, medically treatment speaking, is the care that would be provided by one of the rapid medical response teams the same as what would be provided by a community-based rescue?
Yes. So it'll be a little bit further on when we talk about staffing levels, but everybody that would be on the rapid medical response team would have to be an EMT at the least, which is the same when you're talking about a rescue responding to an EMS call. There has to be at least 1 EMT on board as well.
I would just, my hope is not all the rescues in the county are working up to their full capacity, right? Our full capacity as rescues is we can carry epinephrine, we can carry CPAP, we can do a lot, but there's a leadership aspect within the volunteer fire companies. You have volunteer rescue leaders, and they might be new in their role, or there might be a lot of transition. So my hope is when the county initiates this program, that the people involved in the program can ensure that every rescue, as well as all the county units, are working up to their full scope allowed under New York State law.
Thank you.
So these are a couple of maps that we worked with IT to get. The one on the left shows a 15-mile radius from the Brooktondale Fire Department, the Newfield Fire Department, and Lansing Fire Department. And the one on the right is a 15-minute drive from those departments with the addition of Enfield Fire. So when you look at these, you can see that just positioning a vehicle in those areas will cover the majority of the county, and the parts of the county that it does not meet are the ones that have an ambulance within their community.
Sorry, can you explain the right map a little more? I don't really know what I'm looking at.
The one on the right?
On the right, yeah, the left makes sense.
So the purple are basically the roads throughout the county, and that's showing how far you can get from those firehouses within 15 minutes.
Thank you.
So our vision of partnership with this is that any time that a medical call comes in, that the rapid medical response and the community-based service will be dispatched at the same time with the transport agency by Tompkins County 911. The rapid medical response team will respond to the scene. If the community-based rescue is available, they will also respond and cancel the county car, so that way they're in service for another emergency that might come in. So as we already talked about, all the staff that would be employed for the rapid medical response would have to be EMT basics or higher, and they would be reporting directly to the Department of Emergency Response. Staffing Model A consists of 9 employees. Each rescue would then have 1 full-time employee, 1 part-time employee, and 1 per diem employee. The full-time employee would work roughly 3 shifts a week. The part-time employee would fill in the remaining 2. The AHJ, which is the agency having jurisdiction, or the local rescue, would be responsible for nights and weekends. And our per diem employee is going to fill in when somebody goes on vacation, somebody goes home sick. If we have a mass incident and we need to call in staff, that's kind of what they would be available for.
Just point out the staffing on the 12-hour shifts and the peak hours.
Yes. So when we talk Monday through Friday, we're looking at peak hours. We're guesstimating that they will be 12-hour shifts, but I think that will be kind of dependent on what the actual home agency is in most need of.
The community-based services seem to struggle the most during the day, where their volunteers are at work. So our hope would be able to augment them during those daytime hours where they don't have as many volunteers. So depending on the geographical area and what the data will actually show as far as those peak times, it might be different for a unit that's staged at either the Enfield or Newfield area versus Brookendale. We might have it scaled based on when we see the greatest call volume, but typically it would be during the day. And then in the evening hours and on the weekends when they have more of their volunteers around, the responsibility would be with the local community-based service.
Can I ask a question?
Go ahead.
Thank you. I was wondering, you had a per diem EMT. So is that like, say, if people are taking time off to help cover?
Yes. Yep. So they would be, if someone goes on vacation or is out sick for the day, that's an individual we can call and say, hey, we have an opening in the schedule.
Okay.
They could also be utilized in the event of a mass casualty incident where we need more staff to the scene. We might be able to call them in if they're available.
For a longer term crisis or more incident. Thank you.
So staffing model B consists of a total of 6 employees, and each rescue would have 2 part-time employees. Again, the home rescue is going to be responsible for nights, weekends, and we would help pick up during their peak hours of need. Each employee would work roughly 2 12-hour shifts a week, and they would rotate. For this example, we used Friday, that they would rotate every other Friday. So with that comes how we want to set up our rapid medical response. Plan A is to look at purchasing 3 SUV-style vehicles, outfit them with emergency lights and sirens, stock them with the minimum requirement for equipment set forth by New York State. It's called the Part 800. In addition to that, we'd be looking at adding some pretty crucial life-saving tools such as an AED, Narcan, albuterol, Epi. This could be staffed by either staffing model A or B. We can mobilize these units throughout the county to enhance our EMS coverage so they wouldn't be stuck in one geographical area. If there's a greater need in one part of the county over the next, we could move that unit to where it's needed. Total estimated cost, startup cost for this does not include the cost of personnel, is just under $220,000. Plan B, we are proposing to repurpose aged out vehicles that are already owned by Tompkins County. Again, we would stock them with the minimum requirements with those few additional extra life-saving pieces of equipment. It could be staffed by either Model A or B. Again, we would be able to mobilize these units throughout the county and utilize community-based stations as satellite locations for our staff to work out of. Total estimated cost with this, again, does not include the cost of personnel, would be roughly $54,000.
Is
If I could
that,
just-
how many vehicles?
That would be three.
Three.
So that still would be three, okay.
And if I could just use an example, because I was asked this the other day about a vehicle that's aged out because of the new fleet rotation. We have a vehicle that was due to be, sold at auction that, we'd like to hold on to just until a decision can be made, because that could be, as a first-year vehicle during the pilot program to see if it works the way we anticipate it without having to go out and buy a new vehicle. So rather than selling it this year, perhaps we wait a year. And then, so maybe we could look at some vehicles that are, intended to be decommissioned because at their end of life based on our new protocol, and maybe just preserve three of them as part of the pilot program.
So our recommendation was Plan B, repurposing the traditionally end-of-life vehicles that are already owned by the county. This is looking at cost savings of about $175,000 to start up. Benefit to us having our own vehicles is that we can freely mobilize the units as we see fit. We can include equipment and supplies or remove equipment and supplies that we deem necessary. We can make sure that all three vehicles are equipped to the exact same, so no matter which vehicle you're working out of, you have the same equipment. And of course, shared services of having the community-based stations allow for our personnel to have a place to go, maybe have lunch, be able to do their patient care reports, and it also gives the ability for citizens of that fire district to see that there's somebody in their station more regularly in the event that they need help. So time frame on all this, the next step that we would have to do is obtain an agency ID number from New York State. That turnaround time is roughly 1 week. Supplies, we're looking at 1 to 2 months depending on back order from the supplier. Vehicle, again, 1 to 2 months. Longest thing is going to be getting radios and computers into the units. Uniforms are about a month on order, and personnel, between interviewing, selecting them, and onboarding them, we're looking at approximately 2 months. The next step, if we so choose to go forward, would be to apply for a Department of Health EMS agency code. That paperwork is currently about 85% done. We would need to outfit and supply our vehicles with supplies, radios, and computers. We would need to interview and hire staff and onboard and train them. Before we wrap up, I wanted to give a really big thanks to our steering committee. This is the group of people that have been working tirelessly behind the scenes with us to kind of develop this presentation, kind of come up with ideas, and really put together what you guys see here today. So I'd like to give them all a really big thank you. And do you have a question? Sorry.
No, why don't you wrap up? I was going to give our guests a chance to talk as well.
Do you want to do questions first and then?
I think maybe have her read a letter.
Okay. So Ellen Woods is here with us today. She is part of our Fire Chiefs Association, and she has a letter that she'd like to read that's from the Fire Chiefs Association.
Yeah, so can you hear me? Is that good?
Yes.
So I'm here in my capacity as the secretary for the Tompkins County Fire Chiefs Association, and they have endorsed a letter to the legislature. Dear esteemed legislators of Tompkins County, the Tompkins County, New York Fire Chiefs Association is writing to express our support for the implementation of a basic life support rapid response system run by the Department of Emergency Response in order to reduce response times in rural areas of the county. We believe that this system would significantly improve emergency medical services for residents in these underserved areas. As you are aware, the current response times for emergency medical services in some areas of the county are longer than desired. This is particularly problematic in rural areas where travel distances can be long and response times can be significantly impacted by traffic, weather conditions, topography, and other factors. In some cases, these delays can lead to serious consequences for our most vulnerable patients, including permanent disabilities or even death. Lansing Fire Chief Brad George expresses the current problem. With the amount of EMS calls on the rise and the number of EMTs declining, it is a struggle to provide quality EMS care at the volunteer level. The BLS rapid response system would consist of a equipped vehicle staffed by trained emergency medical technicians that could be rapidly dispatched to emergency situations in rural areas. The rapid response team would be able to provide basic life support services on site, stabilizing patients and providing critical care until an advanced life support transporting ambulance arrives. This system would significantly reduce response times for emergency medical services, reduce healthcare disparity, and improve patient outcomes in those underserved areas. We believe that the BLS Rapid Response System would be a valuable addition to the emergency medical services currently available in our county. It would enhance the ability of our first responders to deliver critical care to those in need, especially in remote and underserved areas. Furthermore, it would provide a cost-effective solution that can help alleviate the increasingly unsustainable burden on the county's ambulance services. We believe it would also sustain the energy and spirit of our volunteers. With increased training requirements and increased call volume, the strain on our fire company/department volunteers is higher than ever before. The risk of overtaxing or burning out these dedicated volunteers is very real. The number of volunteer emergency technicians in Enfield has decreased nearly 70% in the last 20 years. Increasing requirements for EMT certification and recertification, combined with a scarcity of volunteers who are able to be trained as volunteer EMTs, means that an EMS rapid response run by Tompkins County is essential for the town of Enfield's residents. Enfield Fire Chief Greg Stevenson. We urge you to consider our proposal for the implementation of a BLS rapid response system in Tompkins County. The safety and well-being of our Tompkins County residents must be our top priority, and we believe that this system would greatly improve emergency medical services in our community. Thank you for your attention to this important matter. Sincerely, Calvin Carr, President, Tompkins County, New York Fire Chiefs Association, Deputy Fire Chief, McLean Fire Department.
Thank you. And did you have any personal comment you wanted to make?
I did want to make a comment related to the opioid crisis and response times. So we just hosted New York State in Enfield to do a training on Narcan, and they made a really powerful comment to us that really struck me. So we know that while today we have fewer fires, they burn faster and hotter due to the poly materials in most of our homes. And so therefore they're more dangerous. So the same is true of fentanyl. Unfortunately, with the opiates in the past, there was more time to respond to overdoses. And now with these, with fentanyl, there's less time than ever before. So it's very important now in this time to increase response times so that we have a chance to turn these outcomes around.
Thank you. That's a really good point. Let me just see if Mark wanted to say anything.
I don't have too much to say except thank you. I really appreciate everybody's understanding and receptiveness to this problem, and it's been great. I appreciate what Joe and Mike have been doing, and really I think this is a well thought out plan. And I really appreciate that the legislature has recognized that this is a real need. So thank you so much.
Well, don't thank us yet, because we really haven't done anything yet. So more to come there. Mike.
So I'm just wondering, I mean, so we have a range for the cost of setup. Did I miss the staffing part numbers? I mean, did we get a number of how much this is going to cost staffing-wise?
So that we're still waiting for, because we have been working with HR to get us some numbers, and they're doing a comparable study right now, but we don't have those for tonight, but we will have those shortly.
Okay. Ann?
Yeah, that was one of my questions. So there's not a proposal as far as you're asking us to finance or put this in the budget, I guess. Yet. So
right.
Is there a timeline that you might, I know that's one of the things as far as looking at how much the staffing would cost, and I'm assuming, and there'll be other costs, so it would be helpful, and again, maybe you're already doing this, but like a breakdown of this is the initial cost, this is what we anticipate in the next couple of years, because if, like for vehicles too, if you're using a couple of three used vehicles, is it going to be 2 or 3 years, then we're going to have to pay $300,000 for new vehicles? It'd be good to know what we're committing ourselves to.
No, I completely agree. And I think part of what we're hoping to do with the pilot program is just to see if the concept is going to work here in Tompkins County. Because it's worked elsewhere doesn't mean it's necessarily going to work here. So we thought that this would be a cost-effective way of just seeing how we could roll something like this out if we needed to sooner than later, but also because I didn't want to wait too much longer before coming before the Public Safety Committee, with at least letting you know what we're thinking. So we know that there's a lot more work to do, especially on the numbers, and we've been getting a lot of help from our internal partners to get those numbers, but I just felt that it was really imperative to come before the committee, because I think the ask was last October, and I just wanted to make sure we had something for you soon.
Actually, I would say I'm impressed with the amount of progress you've made so quickly. And I see your hands, but I did realize, are there other guests in this group that are on Zoom that had something they wanted to share with us? Any comment? I see Dan, your hand is up.
Yeah, hi everyone, and I do appreciate you listening to our presentation that we've been working on in our steering committee, and I think Joe and Mike have done a really good job of explaining it. As you can tell, we're trying to fill a missing spot in our emergency response system here in the rural, especially in the rural parts of the county. And I think what we're doing here is fairly innovative and should be viewed as a pilot program. I know it's asking a lot of the county, but I think from my discussions with some of our state reps, I've talked to Senator Hinchey, I've talked to Senator Webb, I've talked to Assemblywoman Kellis, and the governor's regional rep, and gave them a taste of what we're trying to do here. And there's a lot of interest in this model. And it wouldn't surprise me if there's more funding coming forward from the state for this sort of program. And I would just plant that seed in the back of our minds that we may be able to get some support from the state for this type of programming. There is a bill in the Senate and the Assembly. Senator Hinchey sponsors it in the state Senate, and Anna Kellis sponsors it in the Assembly, that would provide a CHIP-style funding, sort of modeled after a formula that we would develop in the state level, similar to what we do with highway funds, to provide funding for a model like this. So I just wanted to put that out there, that we may be able to get some support for this down the road, but if we had it going now,
yes,
we'd have a much better likelihood for some funding.
Yeah, no, good idea. Okay. Veronica.
Thank you, Rich. I think, correct me if I'm wrong, but I think this legislature did pass a resolution voicing support for that bill. Or am I misremembering?
No. You did?
No? We did?
Yeah,
okay.
I think we did, yeah.
Yeah, cool. Yeah, thanks for that. I've lost my question. Oh, yes. If we were ready to say, yes, let's go full steam ahead with your proposal now, what would the timeline be given the county budget and the months to things that you laid out? I don't know who this question is to on that side of the table.
I would say typically when there's a request for a new program or additional staffing, those are considered along in the county budget process. So because, you need to compare apples to apples with other departmental requests and prioritize, what's.
So January.
Yeah.
January's the soonest, you're saying?
But it would be we would be deciding about this in this year's budget process, just.
For 2024, yep.
Yeah.
Mm-hmm.
Mike.
Well, I just wanted to say a couple of things. Well, that brings up the whole thing. I'd recommend we do not wait, and we do not do that as part of the budgeting process, that we do this much sooner. We do it out of contingency fund. And then, if you were saying, what could we do today? Obviously, we can't budget the 54 because we don't know what the hiring is going to look like. But once we have that number, I think we can take action. And number two, if we were going to give a directive, I would like to give a directive like, start saving 3 cars. Like, I mean, you've already put one on hold. Like, where can we find the 2 other ones? In other words, I'm kind of ready to go forward with it. I think other people are too. I'm not going to speak for anybody, but I think there's probably a good level of support for this. I would be surprised kind of if there wasn't. So what would be the next step that we could do today to kind of move the ball? And I'm not prepared to wait till January for it. I mean, that's
Okay.
forever.
Well, that's the will of the committee and the legislature. We'll see where this goes. Yeah. Okay. Ann? And then Lee, did you have your hand up? No.
Yeah, so a couple more questions. So as part of this, so this is a pilot program, but I guess for me, and I don't know if this is something doable, but what would help me is to see the long-term costs, just thinking about our budget for this year. We're going to be really struggling figuring out our budget for next year because we have increased costs and because of a couple different things going on. So, just if it worked, like I realize it's a pilot, but then if it worked, what would be our costs, down the road?
The projections down the road.
And
like
I know
5 years.
because we don't know about the state funding. Could some of that be, could we charge some, some of that going to be reimbursed by insurance? And, there might be some of that. And let me see if there's anything else. I agree that, let's try and do something as soon as we can, but I also just thinking, just trying to balance the fiduciary responsibility to our budget. Just need to know some of those things. Thank you.
Okay. I'll jump in if you guys are good. Nice report. And boy, it looks like your steering committee has done a lot of work. This is, I think, a sensible direction to go in. I'm saying that as a city rep. We have ambulance services pretty good in terms of response time here, but you can't look at the ambulance service in the city without looking at it as part of the larger system, my view. And that unless we address this in a comprehensive way, I don't think any ambulance service is necessarily going to continue to function well given the trends we've seen. I think you're doing great stuff with trying to build the base of EMTs in the community. I did have a question. The American Safety and Health Institute training certification that you have now, where are those classes going to be? Are they at Dewar? And are those fee-based?
So we have the ability to teach them wherever they're needed. So if like a school district wanted to open up their school for us to teach, we could bring our equipment to them. We could teach them out of fire departments. We could teach them at Dewar. We really have the freedom to teach wherever.
And are they free or?
There will be a small cost for the cost of the equipment and the certification, but
we feel that we can absorb that. We feel that as a department, we can absorb that to offer those classes free of charge to the community-based services.
Yeah. It seems like even if we're hashing out vehicles and salary costs and everything else, this is something we can move on right away, is trying to build our base of EMTs, and that makes great sense. The one concern I have is that this is an area the county has not been in. This is entirely new cost, and as Ann said, we are in a difficult budget year. Adding 6 or 9 head count, full-time, part-time, whatever it is, that's going to be a hard decision for us. I think it's a decision we have to address, and frankly, I would probably support, but we got to look hard at the numbers. My concern, though, is that what we want to do is we want to enhance the services. We do not want to replace any of the present services. And if the county just steps in and starts spending money on it, I worry that some of the present services would say, yeah, the county's got it. I hope that isn't the case, but I'd like to make sure that our financial model is set up in coordination with the other ambulance services, that we do not lose anything. And in fact, we build the base of EMTs and the overall system gets bigger and better. And, I don't know if you guys have been playing with any game theory on how do you do that? But I'd like to hear, not necessarily today, but at a meeting coming up, how do we get there?
So we actually, well, the letter that Ellen read came after a fire chiefs meeting countywide, and it was unanimous in that meeting from all of the fire rescue leaders that we needed to move forward with something. So we do have the support of them, with the understanding that we're not here to take over their agencies, that we're here to supplement them.
And I think a good example, like a scenario would be if our rescue is being dispatched into an area that has a rescue, and those are both dispatched, part of that would to work with that leadership and say, if you know your unit's going to be out of service, then we know we can just dispatch our unit. But if your unit is in service, then we'll dispatch that unit first and keep our unit in service. If for some reason they can't respond, because again, they're typically using volunteers, then we're ready to go and we're not mustering. Part of the delay and the reason why you see the response times the way they are is because folks are traveling from their homes to the station and then from the station to the call. So I think there's some approaches that maybe we can look at as a community on how to improve that as well. But I think that if we go into this as a partnership, then our hope is that they can still answer their call if their crew is in service, and then our crew can remain in service for another area that doesn't have the personnel at that moment.
Okay. Well, Lee, haven't heard from you yet.
No, just listening intently, I think you've really validated a lot of work that's been laid out and data that's been accumulating over the years. And I would tell you, Rich, I think just from my perspective of, I won't tell you how many years, you're actually going to provide some relief to these departments and probably keep some in the game that are about ready to just step back and say, we can't do it anymore. We can't support the community needs. The Speedsvilles that are out there and others that aren't far behind. You may just very well give them the relief that they need to regroup and actually re-energize and draw some people into the field. I think this is, well, Michael and I have had a lot of talks here, and Joe and I and others over the years, and I think you're on the right path.
I agree. For the volunteer community-based services, EMS outnumbers the number of fire calls that they respond. So if we can take off some of the pressure that they're having right now, and because they're having so many difficulties in answering the EMS call, it might rejuvenate them a little bit, especially on the fire side, and maybe help preserve the fire side much longer. Ellen, you want to comment on that? We've talked about that.
I just wanted to speak to, I spend a lot of time recruiting and shepherding new EMTs through class. And at this point, it's a considerable investment of time and energy. And a lot of them are like, well, what do I do next? They do want to volunteer. They do want to pay back for their training, but they also would like to work in the field. But unfortunately, the ALS ambulance lifestyle, the way the industry is not necessarily conducive for every person. It really works very well for younger people. The two EMTs that I just certified this year, both amazing, highly qualified responders, are women in their 60s. So they're not going to go down and sleep on couches at Bangs. They're definitely not doing that. But they would take a part-time job for the county. They absolutely would. So I think that I did have the concern, is this just going to make the fire companies give up EMS, right? But I don't think it will. I actually think it will give people something to hope for and work towards as they're completing their arduous EMT training.
Okay. I just jump in. One of your slides reminded me, I was fortunate to work for many years as Lansing town attorney. And I was out there in the years after they disbanded their ambulance service. And there was certainly the loss of that emergency response, but there was a gigantic social cost in the community to seeing the loss of that ambulance service and what that meant for the fire department as a whole. And I'd hate to see that happen anywhere else. Yeah.
So, Rich, if I could just, one more point. In the slides, we talked about how some of our fire rescues are not responding to low-level EMS calls that chances are they're not going to be transported to the hospital. And these are calls that really an EMT has to show up, evaluate the patient, sign a refusing medical assessment form, and go about their day. Those currently are being completed by transport agencies. And these are agencies such as Bangs that could be in the city handling a call. And instead they're tied up on what we call a refusal. So a medical response team, rapid medical response team that is currently working in Brookendale could definitely benefit the city of Ithaca because they can cancel that ambulance that no longer has to come all the way up to Brookendale just to do a refusal. They could stay in service and respond to higher level calls.
Okay. We think the impact would have some positive effects.
Yeah, we do need to wrap up, but Ann, go ahead.
And you can just say yes or no, because I know we need to wrap up. Is part of the conversation where to store the vehicles? Because I know like Enfield and Trumansburg, they're packed, you know, and their houses with their emergency vehicles. And then you talked about where they're staying, so about a place for them to take a nap and stuff. That's all part of this equation?
Yes.
Okay. All right. Thank you. Good luck. And thank you for doing all this.
Thank you.
Yes, so next steps, it sounds like you have more budgetary information to bring to us. And I guess we need to do some work on our side on thinking about how soon we would want to try to make a decision. Do you anticipate you'd need funding to expand the EMT training portion of what you're doing, or is that just underway?
I'm going to say no at this time. I guess don't hold me to that. I think it'll depend on what the interest shows as it grows.
Okay. And again, that's something I really feel like our department should be offering to community-based services because sometimes they struggle in that area as well, and I think we should be able to help.
And you have the budgetary capacity now to do that? Yeah. Okay, good. Well, more to come. And yes, thank you. This is really exciting. This could be a very, very positive thing for Mike.
Are we saying we probably will have those hiring numbers by next meeting?
Yeah, how much time do you think you need to come back to us?
I'll have the hiring numbers by next meeting, yes.
Let's plan on talking about it a little bit more then.
And I'll have some more of the other numbers that Annie had talked about as well.
Yeah, special guest stars with us. Kathy Cover. Mike.
No, it's like Kathy has free parking here or something.
Yeah.
Should. Lifetime parking. I think we actually did something like that.
Anybody else before we move on? Again, that was just really good stuff. So, okay. And Matt Van Houten, sorry to keep you waiting there. That was a little bit longer than I anticipated, but builds a little drama for your presentation. Welcome.
Drama? I'm not so sure, but thanks, Rich. I will try to be quick, but obviously always open for questions. My data analyst is starting next week, so I'm very excited about that. And hopefully she will start producing some great transparency for the community. I was thinking about the question about the spike in burglaries, and I don't see that either in my office. There certainly have been a few people who have done multiple burglaries over the last year or so, and they're in jail. So those individuals are not doing those, but there are always people doing more burglaries. But I don't think there's a spike. So if it's in the news, it must be true. But note the sarcasm in my voice. I guess I can, maybe at the risk of opening up or going down a rabbit's hole, just really briefly, I was approached last year by one of the city council members with an anonymous complaint that, or an anonymous allegation that members of IPD were committing a crime, double dipping when it came to overtime wages. Many people don't understand that my office doesn't conduct investigations. We rely on the police to conduct investigations. So what I did was consult the state police and the AG's office to see who would be most appropriate to conduct that investigation. Thankfully, the investigation was done by the state police and came back that there was no wrongdoing by anybody at IPD. So the allegation was unfounded. People are now mad at me because I will not investigate the whistleblower or ask for an investigation to be conducted of the whistleblower. A couple things with this. We investigate, or I follow up on investigating crimes, and there was no crime that anybody alleged that the whistleblower committed. So if you're mad at them, that's not a reason to investigate them. And public policy discourages the investigation of whistleblowers. We want to encourage whistleblowers to come forward and create transparency in government and not have them worry about being pursued. So that's where that matter stands. If there was an allegation that the whistleblower committed a crime, then that would be different. There is no such allegation. And I'm not going to ask for an investigation of somebody because people's feelings are hurt.
Okay. All right, Mike, you had a question?
Well, yeah, so the state police investigation, what did they determine about the claim, though, that it was, when you say unfounded, that there was no truth behind it, or?
Right.
So that the person made it up, then, is what they're saying, or not saying?
Well, it's an anonymous complaint, so we don't know who that person is, and whether they were mistaken, whether they got bad information, whether they made it up maliciously, they can't say. And we can speculate about that. Lots of people think that it was done maliciously. If it was, it's not a crime. And falsely reporting an incident is giving a sworn statement to police. That wasn't how this happened. But anybody who thinks that I would be okay to just ignore that kind of allegation about serious crimes being committed, that's just not how it works. You can't ignore allegations of crimes, even if ultimately they are found to be false. So,
right. No, I am understanding what you're saying. I had an issue with the reporting too, because I mean, what the state police basically said was this person really wasn't a whistleblower.
No, nobody said that at state police. Nobody said that in any capacity.
That they weren't a whistleblower? I mean, if you're blowing the whistle.
No one in any official capacity said that person was not a whistleblower. There is some social media chatter where somebody was saying that. That's worth nothing.
Well, I'm just saying that if maybe this is semantics, but if you're blowing the whistle, that means you're blowing the whistle on some kind of activity that is criminal. And if this came back and said, no, there was, not only was there nothing criminal that we could charge somebody with, that it was unfounded, that there was nothing there to even begin with, then you're blowing the whistle on nothing. So can you really be considered a whistleblower at that point?
I guess I would jump in from my capacity as a compliance officer in my former life, that you'd sometimes get reports that you'd investigate and you find, no, there really wasn't a problem here. And at the same time, you wanted to encourage people to come forward and to report. You know, you wouldn't criticize somebody for raising an issue. I can think of one in particular where somebody said we didn't follow a particular technical process in doing some tests. And I did a fairly extensive investigation of that and said, no, we did follow our process. The person didn't understand this element of how the process worked, and so they thought we had done it wrong, but we hadn't. I thanked the person for coming forward because they stood up and raised their hand, but they were wrong. So I could see it in that category too. It also could be malicious. We don't know, I guess. Yeah. Ann.
Yeah, I just want to say, you know, I certainly won't want to label people who are whistleblowers, and that, okay, if they're correct, you know, great, they're heroes. If they're incorrect, they get some type of, they get penalized in some way or as a crime. So again, I don't know about that one particular incident, but at least for me at the county, I would encourage employees, residents, and, you know, to be able to come to us, come to administration or HR, you know, if there's issues. I would never want to create an atmosphere where they would be worried about some repercussions. And I don't know if there's a law.
You certainly don't want
malicious.
there are laws, and you don't, at the same time, you don't want malicious abuse, but it sounds like, Matt, you've considered that possibility and you're where you're at, so.
Well, I think, you know, if somebody was malicious in that initial allegation, there are civil repercussions for that potentially if you find out who it is, but it's not a crime. And it's not something that, you know, I think the law enforcement resources should go towards.
Okay. Well, because we're tight on time, let's move on. You've been reporting that you have trials scheduled through September. How is that all going?
We have one starting June 5th in county court, burglary in the first degree. July 7th is a murder trial that happened in the city of Ithaca. They're continuing to be scheduled, so that hasn't changed. One settled just before the one who was going to start on May 8th. That didn't go. It settled the last minute. The guy pled to the top charge.
Okay. All right. Anything further you want to share with us? Any questions for our district attorney?
I also have a resolution, I think.
I don't see one on the.
Oh, well.
Let's see.
What's it supposed to be?
It was asking for money from the contingent fund for professional services to pay for a forensic pathologist for a murder case, a couple of murder cases that we are prosecuting this year.
We don't have it. Is it urgent? Could it wait till our June meeting?
Well, I thought I filed it. It was supposed to go to budget next week, I think, and ledge June, early June. I don't know why it's not on the agenda,
Just through budget, but not here?
I will check and see if it's going through budget. But if not, maybe Matt, you and I could work on it and I'll bring it to the full legislature as a member filed.
Okay, I appreciate that.
If it's time sensitive, and it sounds like it may be.
Well, this forensic pathologist, the autopsy provider, has already done a significant amount of work and is waiting patiently to be paid for that part of it. So. Okay,
let's talk offline. We'll manage it. We'll manage it. Okay.
Thank you.
Great.
Sorry, Rich. I actually just found it in, it's still in draft status. It has not been officially submitted. If you'd like, I can.
I was told that it had been, so my mistake, I guess. But.
We'll figure it out, Matt. We'll get it managed. Okay. And by the way, just for the committee, Department of Emergency Response also had an update on the siren program, but we're gonna talk about that in June. So that'll come up then. And anything further, District Attorney? Let's move to Department of Probation and Community Justice. I see Carla and Dan.
He was here. He was joining on his cell phone. I think he dropped the call.
Oh, okay.
It may have been by design. I'm not sure.
Well, Carla, why don't you stand in for him? And let's see. Is there anything you want to share with us to start?
We really didn't have a whole lot of updates. I did want to mention we were looking at our homeless tracking numbers, and we had a pretty big jump from March to April in our homeless and seeking numbers. And we're thinking that that's probably due to the code blue ending. A lot of people that were in the shelter simply because of the cold weather, and now that they've ended that, they're not eligible to stay there anymore. That's the only thing we can think of for that jump.
And that probably makes sense. Do we have any questions or comments from committee members? Saw your report. It does look like things are proceeding on. Again, as I said to the sheriff, thank you for your work on the GIVE grant. Hopefully that'll come through and, yeah.
Yeah. And the only other thing I wanted to mention is I've heard in a couple of meetings people talking about officer wellness. It was brought up again today as far as the critical incident stress management debriefings. I'm not sure if everyone is aware that we have 3 people at probation, myself included, that are fully trained to provide individual peer support as well as group crisis intervention and the SISM debriefings. So if there was ever a need for that, you know, until some of the other departments get their programs fully up and running, please remember us here at probation. We're always happy to help.
Oh, very good information.
Carla, I'll reach out to you tomorrow. Thank you. We'd love to have you on the team.
Thanks.
Mike got so excited he broke the microphone.
Yeah. Oh, that's really good information. Thank you for sharing that. Okay, anything further? We will keep going. Assigned counsel program, I see Lance is with us. Welcome.
Good afternoon, everybody. I'll try to be quick. Just to update you, as you know, the state budget passed. There was an increase in the 18B rates to $158 an hour. Half of that increase for the next year will be covered by the state. We're going to get the official certification in process from ILS in a couple of weeks. The way this is going to work is our Department of Finance will certify to the state what the amount to be reimbursed is on a quarterly basis. That'll flow through the Office of Indigent Legal Services, which is the independent state agency that oversees my program, mandated representation programs. We've already started working with finance and admin, including men, and we've already started capturing that data here in some files. So we'll have that ready to go. We can start seeking reimbursements in June. The new rates were effective April 1st of this year. So we've already started capturing that. One thing for you all to keep in mind is this 50-50 split is for the next year, and then there's the possibility of the legislature, the executive revisiting that. So you may want to be active in the fall. I know a number of people are going to be trying to have that so the state covers it all, but just be aware of that issue percolating out there in the future. But I think we have a process in place to move us ahead efficiently and try to recapture our reimbursements on this rate increase.
So our local rate is going to be 75 an hour or 79?
No, it'll be, well, effectively, it'll be of that increase from, let's say, 60 and 75 to 158. The state will pay on felonies $41 of that increase and $49 of the increase per hour for misdemeanors. The county will pay the remaining part of that increase.
Do we have an estimate of what that's going to do in terms of 2022 budget and estimate for 23 or 24?
We're working on that. The one thing I can tell you is the impact is going to be greater later in the year, as there's a delay in vouchers coming in. So we're working to identify that for you. We're working on developing a number of numbers for you for admin and for you to look at to kind of lay out what the lay of the land, so to speak.
Okay, Lisa,
go from there.
Do you have a sense you're going to have I think we're meeting the 30th, is it?
Yes. Yep.
You think you have what you need to talk to us at that point?
Yes.
Okay. All right. How significant do you think the impact is going to be in 23?
Oh, in the current year?
23. Yeah, I guess that's.
Because it's starting now.
I thought it was 22.
Yeah.
Sorry, I think I said 22 earlier, but.
Have, we had estimated about 300,000
For this year?
for the current year, yep.
Okay. Do we have that in reserve, or?
Yes, well, some more
we
to
have it.
more to update you on.
Okay, okay. Well, okay, Lance, thank you for the information. Yeah, and I guess more to come there as we see it roll out. Any questions or comments for Lance from the committee? Okay. Anything else?
Not for me, no.
Okay. Well, thank you. And I'm looking at the agenda. We've worked our way through. Is there any other business to come before the Public Safety Committee? Ann?
Just asking if did we get the presentation that you had?
Yeah, would you be able to share that with us?
Yeah, I can send it over to you.
Okay, great. I didn't know if you had and I missed it.
Okay.
I'll send it with the letter.
Oh, great. Yeah, then we can include those in the minutes, yeah.
Good. All right. With that said, got to get a motion to adjourn. Veronica moves, and seconds. All those in favor? Thank you much. We're adjourned.
Thank you, everybody.